Welcome to today's ADEA webcast titled Responding to the Looming Faculty Shortage in Allied Dental Education. It's now my pleasure to introduce our host, Dr. Eugene Anderson, who is the Chief Policy Officer and Managing Vice President of the American Dental Education Association. Dr. Anderson leads the ADEA Policy Center, which provides evidence-based research and analysis, collaborative advocacy, and thoughtful leadership. The ADEA Policy Center works through 4 targeted portfolios, including access, diversity and inclusion, advocacy and governmental relations, educational research and analysis, and institutional capacity building. We are pleased that Dr. Anderson could join and host today's webinar. Dr. Anderson, welcome to the program.
Thank you, Kurt. For today's webinar, we're fortunate to have Professor Rebecca Stolberg with us to share her expertise on the state of faculty and leadership in allied dental education. Professor Stolberg leads the Department of Dental Hygiene at Eastern Washington University in Spokane, Washington, the state's only Bachelor of Science program in dental hygiene. She also directs the web-based Master of Science in Dental Hygiene program. She serves on the ADEA Commission on Change and Innovation in Dental Education Oversight Committee, and beginning this year, she'll serve as a mentor for the ADEA Allied Dental Faculty Leadership Development Program. Today's webinar will answer the following questions. Is there a faculty shortage in allied dental education? How can faculty mentoring serve as a vehicle for enhancing leadership development among faculty? And finally, how can someone distinguish between the various faculty leadership development programs available? Professor Stolberg, glad to have you with us. Let's start with the first question I want to ask you. Is there a faculty shortage in allied dental education?
Well, thank you, Eugene, and welcome everybody for joining us today. I think there is a lot of talk and speculation around the topic of faculty shortage in allied dental programs. So let's kind of start and look at what the research tells us. So in last fall, the Allied Dental Program Directors Survey occurred. There may be some directors who are on the webinar today who helped us with that survey. And the survey launched in the fall of 2014. It was sent to 598 programs. And I want you to take a look at our response rate, 80% response rate. That is amazing. The survey was put together as a joint effort with the Council of Allied Dental Program Directors and ADEA. And I think that response rate is so fabulous because of how the survey was designed. It was very carefully designed, and it was launched at a much better time than in previous years. In previous years, the response rate had been between 20 and 30%. So kudos to folks who designed this survey and the timing of it, because we got an awesome response at 80%. So 480 programs responded to this survey. So what did the survey tell us? Well, we looked at demographics, and the demographics for last year for the survey, I want to kind of point out that there was 32.5% of you 50 to 59, 16.5% up there just under 70, and look at that, 2% of you are 70 and older. You're really hanging in there. I think if you add those together, it's over 50%. So, Eugene, the question is there a faculty shortage? Well, 50% of us, a little more than 50% of us are 50 and up. So I know that I would like to most definitely be able to retire sometime soon. So I think just looking at our ages, that's a telltale sign that, yes, we are definitely aging as educators. Let's look at the next thing. We looked at employment status. Do programs have full-time and or part-time faculty? And I think what's really telltale here is in terms of new faculty, take a look at this. 72% of new faculty are part-time. And of the total faculty, new and, I don't like to say old, but seasoned, 63% are part-time. So what is this telling us? Well, it's telling us that a lot of us as program directors are hiring part-time. And I think there's issues around part-time faculty, not issues around them as people, but issues around all the commitments they have, the multiple jobs they may have. I certainly know my part-timers are working 1 or 2 offices out in the real world, and then they come here and teach when they can. They're not always present at your programs, at your institutions. They're not at your faculty meetings. I think it's really hard to keep them engaged, involved, and, of course, calibrated, that terrible word that we all deal with on a daily basis. I think budgets are definitely driving this part-time hiring. I know it is for me. The salary package that comes with a full-time faculty position is very costly to a program. So with dwindling budgets, we end up with increased part-time faculty who we can bring on board, help them do a great job, and not have to pay them that benefit package. Now, I also want to, just to clarify, new faculty in this survey, new faculty was not necessarily brand new educators. In other words, their first time teaching. New faculty in the survey is defined as new to that institution or new to that program. Okay. So let's see what's happening in terms of people leaving their positions. In last academic year, programs reported that full-timers left at a rate of 31.6% and part-timers left at a rate of 68.4%. So part-time faculty are leaving at twice the rate of full-time faculty. Now, I think that this would make sense to most of us. They are, again, part-time, and they have other commitments that may pull them away from teaching. But it certainly lends itself to the problem of retention and retaining and helping to keep those part-timers engaged, giving them the skills that they need to stay at their part-time teaching position. The survey definitely lends itself to show that part-timers leave at twice the rate of full-timers. So the next topic that we talk about a lot in Allied is retirements and or losing positions. So for the last academic year, programs told us that, okay, we have 95 open positions. Now, I want to bring you back to how many programs actually responded. Remember, it was 480 programs responded to the survey. So 95 out of 480 programs had lost faculty last year. Then we asked them the next 5 years. The next 5 years is a little bit of a scarier number at 403. So the inference here is that 403 vacant positions will exist out of 480 programs in the next 5 years. I'm not great at math, but that does tell me that close to each one of us in programs will have a vacancy in 5 years. So almost every program in allied dental education, that's dental hygiene, dental assisting, and dental laboratory technology, are going to have an open position in the next 5 years. So I think that really lends to the fact that, do we have a shortage of faculty? I don't know. You tell me. Okay, so we are going to get some information from you on this webinar. Kurt, are you going to?
And our first poll question is now open. Do you think you'll be having a faculty retiring or leaving your program in the next 5 years? And we'll give everyone about 15 seconds to respond to that. And last 5 seconds, please make your final choices. We'll go ahead and stop the poll and then get. And that poll has been stopped. Let me share the results, and with that, I'll turn it back to you, Dr. Anderson.
Thank you, Kurt. So according to our audience today, we have 50% of you said you will have at least one retiring, and then a third of you said 2 to 3, and we've got 7% in possibly dire straits with more than 3 retiring in the next 5 years. I think what this shows us with so many allied dental programs is the picture may look different at the individual program level, various size faculties, but certainly may still pose some challenges regardless of the number, whether it's 1 or 4 retiring in the next year. Rebecca, what are your thoughts on seeing what the audience is telling us about their own institution, their own programs?
I see exactly what you just stated, Dr. Anderson. It's interesting. We have, looks like roughly 165 people on the webinar, and half responding that they're going to need at least one. It's a high number. That's a pretty darn high number, given that, we only have so many graduate programs in certain areas, and the fact that we've got all this faculty aging, which, we can't really control. I think that we've got a looming problem.
All right. For any listeners who've recently joined the webinar, welcome to our program. Today's webinar, The Looming Faculty Shortage in Allied Dental Education, is being presented by the ADEA Policy Center, which supports ADEA's role as the voice of dental education. My name is Dr. Eugene Anderson, the ADEA Chief Policy Officer and Managing Vice President. To learn more about the ADEA Policy Center, we encourage you to visit ADEA's website at www.adea.org and click on the Policy tab. Joining us today, once again, is our leading expert, Professor Rebecca Stolberg from Eastern Washington University. Before we continue, we did a poll at the very start of the webinar to get a total count. We know many times folks are watching the webinar with some colleagues or even a large group. We've had a lot more people join the webinar since we did that first poll. So I'd like to ask Kurt if you could do the head count poll again, please.
Happy to do so, and that is now open for the audience. Again, please reply by clicking on either the radio button or the color box for the number of people at your site, and we'll clear that in about the next 10 or 15 seconds, but in the meantime, we can turn it back to you, Dr. Anderson.
All right, thank you, Kurt. Professor Stolberg, is there an effective way to address the concerns about future leadership of allied dental education? We certainly see both from the survey that ADEA conducted last fall, as well as our participants today, that they do see faculty retiring over the next 5 years. So how do we address this issue?
Yeah, thanks, Dr. Anderson. Well, whether we have enough data or not, I think we have an obligation to prepare our future leaders and our future faculty. And I think mentoring is a start. I think there's a lot of ways to tackle this problem, but for the next segment here, I would like to talk about mentoring. I believe mentoring is a way to enhance our future academic leaders. I think it can be a very effective tool for promoting skills that are necessary to be an allied dental faculty. I think it will help us prepare part-time and adjunct faculty to assume more roles. But we need to do it right, and we need to provide them the necessary skills to make them successful. And I think good mentoring includes a lot of, well, it's a lot of work, which we'll talk about in a minute, but it's also very, very important. I think there's three key things that mentoring needs to include, which is teaching assertiveness skills, conflict management. I know nobody on this webinar has ever had a conflict with another faculty member, and self-assessment skills. So let's look a little bit more at a definition of mentoring. Mahares, in 2013, has this definition of mentoring. Mentoring is an interpersonal process that takes place between the trained, let's look at that word, trained, seasoned, mentor, and a novice protege. After accounting for cultural differences, mentoring entails providing emotional support, sharing of knowledge, experience, role modeling, and guidance. Now, I'd like the participants just to think for a few seconds here, how many of you are trained, seasoned, and capable of providing emotional support, sharing knowledge and experience, role modeling, and guiding? Tough job. Very tough job. So when we think about mentoring, we have formal mentoring programs and informal mentoring programs. To be a true formal mentoring program, there needs to be training for both the mentee and the mentor. Again, going back to Mahari's definition, trained and seasoned mentor will train the mentee, and there needs to be dedication. Any formal program needs assessment and evaluation. It needs administrative support, and it needs to be flexible. So, how many of these exist for allied dental faculty? I pose that question. I'm going to give you examples of two. There's one at UNC, University of North Carolina. They have developed and implemented a faculty mentoring program that's being used as a model program for other schools in the country. The program includes a formal orientation into faculty roles, the academic environment they live in, and there is continuous mentoring with a mentoring team consisting of 3 faculty. Now, the faculty members, they do not include the department chair director. The department chair is also expected to mentor the new faculty member in addition to the team. And the goal, of course, is to help the junior faculty member develop in teaching, scholarship, and service skills. The program does have measurable outcomes and administrative support. So I'll just throw that out there as one of the model programs in our nation is at UNC. The other formal mentoring program that I'm aware of is the St. Petersburg College. The mentoring process was created to assist development of new full-time faculty members. So again, this is for full-time faculty members. It's cohort-based, and each faculty member is provided with a mentor in their department, or if that's not possible, in a department that's closely related. And they get academic support. They help, the mentoring program helps them form professional goals, teaches them what it means to serve the college and to serve the community. There are monthly cohort meetings where they're able to discuss topics of relevance. And although the mentoring model was established formally only during the faculty's first year of service, many mentees reported continuing to work with their mentors for many years. So again, St. Petersburg College, formal mentoring, training, well-established cohort program with measurable outcomes and evaluation procedures. So the other side of that is informal mentoring. This is definitely something I have been involved with a lot. The institution I'm at has no formal mentoring program, so it's all informally absorbed, obtained, and probably many of you in today's room is exactly like myself. There's not been a lot of administrative support for mentoring. There's not money for it. I think informal mentoring happens without us even thinking about it. It should, however, be organized and coordinated. And I think, let's think about lunch and learns. Many of you have maybe provided lunch and learns at ADHA, at ADEA. That is an excellent venue for mentoring. So many of you have probably been an informal mentor without even thinking about it, and or maybe you have been mentored in that way. I know I have. I think a big issue with informal mentoring is that senior faculty have to buy in. Now, let's think about the senior faculty. This is that 50-year-old at your institution who's been doing this. Okay, I'm not quite 50, to be honest, but I've been doing this for 20-some years. How much time do I have? What kind of training do I get? And do I even buy into the fact of mentoring? I think we've all known people who probably would not be the best mentor. Some senior faculty just don't want to be involved. And I've even heard some senior faculty say, oh, it's a rite of passage. I had to figure this out by myself. I'm going to make sure they figure it out by themselves. So senior faculty buy-in is essential for informal mentoring. So up until now, I've been kind of talking about mentoring for part-time, full-time faculty. But what about our students? Are our students not an untapped resource of the future? Research shows that mentoring students for careers in academics can be very successful. And allied dental faculty can role model for students. And I mean full-time and part-time faculty can role model for students. So a long time ago, a wonderful, amazing mentor I've had, Professor Phoebe Blitz, introduced a great idea to us here. She said, let's start a teaching track, elective. Let's get our current senior students as teaching assistants. And let's role model and mentor to them the steps of being an educator and a leader, because educators are leaders. So what do we give them in that program? Well, we talk about learning styles. We talk about legal issues and HIPAA issues surrounding education. We talk about accreditation standards. All educators don't need to do the CODA self-study report, but they certainly need to have a background and an understanding of what the regional accrediting bodies do for the universities and colleges we are involved with. They need to understand what CODA is. We gave them some conflict management training. We talked about the uniqueness of adult learners. We taught them how to use guided questionings and I statements to communicate better. So this doesn't come without challenges. We had some faculty were kind of just buddying up with the teaching assistants. That's not the point. This is not a buddy system. This is a mentoring process. We even had some faculty, full-time and part-time, not wanting to be observed by the teaching assistants because they were feeling judged. Rather than embracing the opportunity of interacting with the future, they were feeling judged. Let's face it, one of the biggest challenges is taking the time. I call it just taking the time. Do we have the time to be a mentor? We need to make sure TAs are calibrated. They had to be calibrated with what they were doing. But let's look at the benefits. We're not only role modeling and mentoring, we are actually leading these folks to a very rewarding career. They gain self-reflection skills. They gain self-esteem. They understand what it means to be a professional and to potentially be an educator. So, that's an example of student mentoring.
I want to also tell our participants today that if you have questions for Professor Stolberg, you can enter them into the chat box, and we're going to have time at the end for some of those questions. Now, Professor Stolberg.
Yes, okay, we will move on.
Yep. So, how can mentoring help? Can you just share briefly with us how mentoring can help address the faculty shortages?
Absolutely. A study out of USC in 2003 talked about qualities of good mentors. We've touched on a bit of this in the previous section, but there needs to be a commitment. We need to be encouraging, respectful, time. Again, that dreaded time. We have to be willing to share, and we have to be willing to be the role model. Being mentored is not being a buddy of your mentor. Being a mentor means way more than a friendship. Studies have shown that career satisfaction is increased and workplace stress is decreased by having a mentor. I could not imagine life without some of the mentors I've had. And really, without some mentoring of those part-time adjunct folks, retention is going to be a problem. It's going to be a problem for other reasons as well, but I think mentoring will help that. So let me tell you briefly about an eye-opening experience I had here at my institution. Typical day, I know folks on the webinar will understand this. You got a headache, your supervising dentist did not show up to be on the clinic floor, everything's gone wrong, a part-time faculty member has called in sick, so you are now drugged down to clinic, you're racing around, you're trying to be on the phone to find a supervising dentist, you don't feel good, and I had a student stop me in the hallway and say, Professor Stolberg, why would I want to do what you're doing? Look at you. You're running around like crazy. You look exhausted. You've got all these responsibilities. You take your work home at night. Why would I want to do what you want to do? And I think this was a real eye-opener for me of stepping back and realizing that everything I do is being watched by somebody. And being that professional role model is truly what I am talking about here. We can all do this. We can all be a part of mentoring. And I think there's also things that can help us mentor better.
So let's talk a little bit more about some of these professional development programs, Professor Stolberg. Can you tell us what kind of programs are available for allied dental faculty, programs that, as we've discussed, can promote leadership and address potential faculty shortages?
Sure. I'm going to talk about 4 leadership programs that I'm fairly familiar with. ADHA's Unleashing Your Potential, the ADEA Allied Dental Faculty Leadership Program, the ADEA Leadership Institute, and the ADEA Academic Dental Careers Fellowship Program. But first, I have a question for you all. Which of these programs are you aware of right now today?
This particular question will be an all that apply, and that question is now before you. So you can select all of those that would apply to which of these programs are you aware of. And we have ADEA Unleashing Your Potential, the ADEA Allied Dental Faculty, ADEA Leadership Institute, and ADEA Academic Dental Careers Fellowship Program. We'll give everyone a few moments to complete that, and then we'll view those responses and look for comments, starting with Dr. Anderson.
Thank you, Kurt. So based on the responses...
And we have stopped the poll, and they are now shared with the audience. Okay,
great. So it looks like there's good awareness of many of these programs. ADHA Unleashing Your Potential, 58% are familiar with. Got almost over 70% familiar with 2 of the ADEA programs, the ADEA Allied Dental Faculty Leadership Program and the ADEA Leadership Institute. And just over a third familiar with the ADEA Academic Dental Careers Fellowship Program, which is a newer program targeted towards students, so we're still building promotion of that program. Professor Stolberg, your thoughts? It seems like a large share of our participants today know about many of these programs.
Yeah, I'm actually very impressed with the participants. I think up until recently, I had no clue what number 4 was, the Academic Dental Careers Fellowship Program. But I think a lot of people have a good knowledge base of what ADEA offers. And if they are involved with ADHA and in constant communication with ADHA, they would know about the Unleashing Your Potential. So really smart group we have with us today, because they actually know quite a bit more than I thought. So let's talk about these 4 programs a bit. Just for those who don't know. The ADHA Unleashing Your Potential happens each fall. It's a weekend program in Chicago. There's 40 applicants selected, and they select their applicants based on they're wanting to be a leader and take fiduciary responsibility for the future of the profession. And they look at collaborative leadership models, and it's an opportunity to network with the ADHA leadership in Chicago as well. There may be some folks who are on the webinar today who have attended this. Long ago, I thought this was just for the future presidents of ADHA, but since then I've come to know that it's for anybody who wants to apply and to develop their leadership skills. The next program is the ADEA Allied Dental Faculty Leadership Development Program. I was in the inaugural group of this. I was proud to be in that inaugural group. Wendy Kirschbaum was my mentor for this, and I still remember her, the entire event, and how she mentored me long after the event occurred. Of course, attendance is limited to 15 to 21 participants. There's multiple individual assessments that you could see they do. And the key content revolves around gender differences, work-life balance, meaningful work, and the legal and ethical climate that we live in allied dental education programs. I'm happy to tell you that there was a ton of applicants for this summer's ADEA Allied Dental Faculty Leadership Program. So things are growing, and this is a fabulous program. The ADEA Leadership Institute is a year-long program. It has 4 phases that they participate in. I believe there is some travel. There's personal and interpersonal competencies for leadership. There's a legislative piece. I never thought as an educator that I would need to deal with legislative issues, but as mid-level provider efforts are growing, I've had to become involved with that. As budgets are cut, I've become involved with legislators, speaking up for funding our programs and funding our institutions. So that's a fabulous piece there and something not to be overlooked. There's the administration piece, of course, and how to integrate it all is the 4th and final phase of that institute. And lastly, the Academic Dental Careers Fellowship Program, which is a program that matches faculty to students, and the students are provided a structured mentoring throughout their student career into what an academic career might involve. The faculty and student collaborate on a research or teaching project, and the faculty is thus the mentor for understanding what an academic career is. So I will move to my references because this ends the formal part of the program.
Thank you, Professor Stolberg. And folks will be able to get a copy of this presentation, and certainly the references are helpful for those who want to follow up. Let's start with some of the questions that we're getting from our participants. Professor Stolberg, one person asked us about teaching assistants and the role that can play. Do you know if there are a lot of dental hygiene programs out there that utilize TAs?
I don't have any research data to present on programs that have teaching assistants. I can tell you 2 or 3 years ago, I presented at the ADEA Allied Directors meeting our program in forming and mentoring teaching assistants. And there were some participants in the audience who, raised their hand and shared their own personal thoughts. I think one thing that I gathered out of that presentation was that people don't realize that could be a potential until they hear about it. And so there was definite interest in some programs of going back and figuring out how can that work at my institution. I am at a 4-year university, so I think it's a little bit trickier to make that work in a community college program, but there's really no reason why an upperclassman cannot mentor a lowerclassman. So, sorry, I don't have any data on numbers, but I think it's possible, and I would be happy to, mentor anybody who wants to look at doing that.
All right, Professor Stolberg. Next, I want to ask you about this increasing use of part-time faculty, certainly something that we're seeing throughout all of higher education. And when we look at the survey from the program directors, you referenced this stat earlier, of all allied dental faculty, 63% are part-time. And when we just look at the new faculty, 72%. So even an increasing share down the line. What are the potential impacts for the future of allied dental leadership with this growth in part-time faculty?
Well, I think that part-time faculty, as I stated, have all of the competing interests in their life. So I don't ever want to, say that part-time faculty are not committed to leadership. I think they have a lot of things to do. I have part-time faculty that are exceptional on the clinic floor and have great leadership potential. What I don't have is a formal mentoring program that allows me to develop those skills that they have in them and to actually show them that they could do this full-time as a faculty member, or they could be a leader in their state dental hygiene association, or they could be the president of their state dental assisting association. I think that it's real important that people continue to look at those values and skills that people have and nurture them, because we've got full-time people leaving the profession, we've got part-time people leaving the profession. We need everybody we can get. And I think that adjunct faculty, those part-timers, are key people to either step up to the plate and or become full-time eventually. I've certainly had that happen at my institution, and become the future leaders.
Thank you. Thank you for that answer. We talked about mentoring and the importance of training for both the mentor and the mentee. Any tips for folks on how you pair a mentor and a mentee together so that both get the maximum benefits?
That's a great question, Dr. Anderson. I think there's a lot of ways to look at that. I would, the key again is finding those that have the interest and passion. As I said, we don't, just because they are senior faculty does not mean they are going to be maybe your best mentors. So do they have the passion for developing less nurtured, less developed folks? Do they have the time? Time is a big factor. And do they have some sort of connection with that individual? I've seen some of the mentoring programs that I've reviewed. They randomly put people together, and they're not always as successful. So, what are their? Do they both have Wednesdays off, Wednesday afternoons off, where they could go and have coffee? I certainly mentored someone here at my institution. We met down the street at Starbucks Tuesday mornings at 9 o'clock because it was a joint time that we had off, and we shared the same passions about the profession. We had that time to devote to one another. So that's all of that informal mentoring. And then I think the other thing we need to do is to most definitely talk about some of the more formal mentoring programs that exist and how to increase access to folks in those, whether it's web-based stuff, whether it's regional workshops. I think there's a lot more that could be done formally if we can figure out the way to do that.
Okay. Well, with regards to mentoring, I want to stay here for another minute or two. In terms of the skills that a mentor should really pass along to their mentee, what are some of the top skills that they should focus on? And one of our audience members asked, how important is teaching the use of technology in teaching as a skill?
Well, technology is a scary beast. Doesn't always work. I think technology is important, very important. I think I come at mentoring more from the standpoint of those skills to be successful with your colleagues and to be successful with students. So in terms of being successful with students, technology is very, very important. In terms of being successful with students, so is emotional handling of crises, and that's some of that emotional intelligence stuff that we saw in the definition of a good mentor. I think our students now, students and faculty, are coming in with very different generational differences. They're coming in with very different backgrounds. I think every educator would tell you stories of, what their students are experiencing on a daily basis is not what I experienced as a student on a daily basis 26 years ago. I think, so we've got to give them those skills to be assertive, not aggressive, to be emotionally supportive, but not a friend, to give them conflict management skills, and those conflict management skills deal with students and coworkers. So technology is a piece, for sure. To tell you the truth, I would not be a good mentor for technology, but there are faculty in my program who are awesome, with technology. So if they were paired with the right person, that could be a great mix in terms of a mentoring relationship. So I always look at those soft skills, and I think people don't like to talk about soft skills and the hard sciences, but it's really those soft skills that give people the ability to be a good leader.
Are those innate, or can those soft skills be taught?
I think both. I think some people have just an innate genetic ability to utilize their soft skills better, but I think they absolutely can be taught and mentored.
Okay. One of our participants also wanted to know a little bit about minimum or maximum teaching requirements from allied dental faculty. I'm sure as you meet folks in your community who are practicing professionals, considering possibly faculty roles, that they ask you what's the minimum someone could do in teaching, what's the maximum. So generally speaking, what would you say, Professor Stolberg?
I guess it would depend if it's full-time or part-time. This is an answer that's really all over the board. Here in my institution, we are unionized, and we have distinct. We are not allowed to teach more than 12 hours a week face-to-face with students, and then the rest of your week and your hours is spent in research and service commitments and preparation, of course, for your face-to-face hours. I have part-time faculty that teach 3 hours a week for me, as little as 3 hours a week, and I have part-time faculty that I push the envelope and have them teach just under that 20 hours so that budgetarily I don't have to give them the benefit package. So I think there's a wide range. I know that community college educators, I've been in that system as well. They have a lot more face-to-face time with students because there is supposedly less of that research and service commitment. Although I think every educator on the webinar would agree that whether you're at a community college or a university setting, if you're passionate about what you do and you're passionate about the future, you do those other things. So I think community college educators work really, really hard and put in a lot of hours, mandatory. So it's a hard one to answer, but it's all over the place, literally. And then again, you've got some quarter-based schools, some term-based schools, and some semester-based schools. So that will be different as well.
All right, Professor Stolberg. One final question as we wrap up. We talked briefly about the role of technology as a teaching skill, but let's pull back and let me ask you about technology from a larger perspective. As we think about the looming faculty shortage, which certainly is not only related to allied dental education, do you see the emergence of various technologies in the delivery of education that could have an impact on what the future looks like? You've got online courses, certainly pretty much at every institution. You now have a growing movement of open online courses, commonly referred to as MOOCs. You have faculty who are full-time at one institution and maybe lecturing remotely all the way across the country. So as you think about these trends that are happening in higher education, how do you see that potentially impacting the future of allied dental education?
Well, Dr. Anderson, great question. It's actually a loaded question too. So let's talk about that. We've got this faculty who already has a time commitment problem. We already don't have enough time, and we've got a lot of things on our desk, a lot of things on our plate. And now we've got a shortage of faculty at another institution. So we're called up and we are asked to give a web-based course to their students on something that we are passionate about and that we actually know a lot about. And so we say yes. So all of a sudden you take someone who's working 100% and you add them on, and now they're working 130%. So that's one issue. I think that the issue there is, how far do you push that envelope before it's not quality content and quality delivery? MOOCs are a very interesting thing. I've watched our institution and our various curriculum committees argue a lot about MOOCs. Are we going to accept them in terms of our prerequisite courses? Are we going to accept a certain number of them? Very interesting discussions around MOOCs. And I bet others on the webinar here are having those similar issues at their institutions. This is all those background things that an educator maybe doesn't have to be a specialist in, but they definitely have to know they exist. And then you've got online delivery. Not all online courses are good courses. I've seen online courses that were absolutely terrible because they took everything that they did in the classroom, copied and pasted it into a learning management system, and that was their delivery, versus actually having instructional technologists help you with the content and to develop what you're trying to do to something that works in the online environment. So we have got all of these competing forces coming at us as educators, and I think that's some of those skills I was talking about that mentors can impact and can help people deal with. That brand new educator who's fresh out, let's say it's a brand new educator, not just new to the institution, but new to the profession. And they come there and they've got all these fabulous technology skills they've been introduced to. And how do they manage that? And how do they not get overcommitted in time? And how do they manage their day-to-day life and still not lose their sanity? I talk to new program directors weekly who say, how do you do this? How do you not lose your social life, your family life, everything else while you're doing this? And the tough part is, as I've just said today, you got a role model that this is an awesome thing to do. So again, it's tough. It's tough, and I think we're going to see a whole different future in terms of education because of this technology and what's evolving.
Well, on that note, I want to thank you, Professor Stolberg, for joining us and sharing your expertise on this important topic. I want to thank everyone who spent the past hour with us, and I will turn it over to Kurt, who will give final comments regarding evaluation and CE.
Thank you, Dr. Anderson.
And in the upcoming weeks also, we will be letting you know about our next webinar, which will be in June. Kurt?
Thank you, Dr. Anderson. That does conclude today's presentation responding to the looming faculty shortage in allied dental education, brought to you by ADEA and presented by Professor Rebecca Stolberg. Your ADEA host was Dr. Eugene Anderson. We do hope everyone enjoyed the presentation. Continuing education is available for this presentation. To obtain CE, enter your name in the site roster. You will receive an automated email with a link to the evaluation and a link to the certificate manager. Complete the evaluation form and then you may retrieve your certificate. You will be redirected to the site roster as we end the presentation. And be sure to follow ADEA Web on Twitter to join the conversation using the hashtag faculty shortage. Again, the hashtag is faculty shortage. You can find the recording and presentation of the program at www.adea.org/moving-IPE-forward, which will be posted 1 week from today on May 5th. Today's program is copyrighted in 2015 by the American Dental Education Association, all rights reserved.